Peen gives you pus, worms, parasites, and cancer, part 7. Picking up where we left off with syphilis. As you can see, you can go 10 to 30 years after having had your first little bumps of syphilis, and then all of a sudden, your heart, your brain, your internal organs can become diseased and damaged and can result in your death. Now, mind you, when these things happen, do we now go back and say, oh yeah, it was a syphilis that you didn't diagnose 30 years ago? No. You have heart disease. You have, let's go on to see what we have. Let's talk about it. Without treatment, syphilis can spread to the brain, the nervous system, the eye, the ear. Wow, just from a little sex? Here are some of the symptoms. Severe headache, muscle weakness or trouble with your muscle movement, changes in your mental state, confusion, personality change, dementia. 30 years later, who is undiagnosed is going to go back and say, oh, you have syphilis. No, they don't do that usually. Let's keep going. What else can you? Wow, eye pain, redness, changes in your vision, and even blindness. Hearing loss, ringing or buzzing or hissing in the ear, tinnitus. What else? Anything else? Many refer to syphilis as the great pretender, as the symptoms can look like many other diseases. So typically, it follows a progression of stages that can last for weeks, months, or even years. The great pretender. Many other diseases that you didn't consider, that you would never think that came from having intercourse. Average time between the acquisition and the start of symptoms is 21 days or can range from 10 days to 90 days. What are the signs and symptoms? As mentioned before, some regular ass symptoms. Regular. Something to note, gay, bisexual, and other men who have sex with men are experiencing extreme effects of syphilis. They account for 36% of all primary and secondary syphilis cases and 47% of all male. I don't know what PNS means, but it doesn't matter. However, rates are increasing among heterosexual men and women in recent years. It's a problem. Part 7 coming soon.